I'm not even going to wait to put on my glasses because I'm that old. Thank you, Dr. Axelrod and staff, for the honor of participating in your program. 9 months ago, I would have never believed that I would be standing here. I would have been one of you in the audience. I would have been championing on one of my friends, one of my family members, everybody that I love, because that's who I am. I'm the caregiver, never the patient. Instead, I am a new face of cancer. In July of 2002, I had a summer cold that just refused to go away. I tried every over-the-counter medication to no avail. Fast forward to the weekend of August the 1st. My husband and I were out of town, and I couldn't breathe. So off we went to an urgent care in small town USA. All the proper things were done with the exception of an x-ray since they didn't take our insurance. And the doctor was very kind since he didn't want my husband to get a bill for about $3,000. In that case, I wouldn't be here speaking. I would be dead already. August 4th, we had an appointment with our internist at 3 o'clock. Monday, our internist said, why don't you go to Doc's and get an x-ray, which I did. And before my tush could be back on the bed, on 36th Street, the phone rang, and it was the technician who said, we have spoken to your internist. You must get back here immediately for a chest CT. Well, that's never a good phone call. I said, fine, I will make one phone call, and that was to my husband. I said, I think we might be in trouble. The second phone call I made was to Dr. Heller's office. Dr. Heller is my thyroid surgeon. 2 years ago, I had been diagnosed with thyroid cancer, and I had my thyroid out. I had RAI, and everything was clean, and I think about 2 months prior to that, I had a full scan and all the blood tests, and everything came out perfect. So Dr. Heller said to me, not to worry, one cancer has nothing to do with another. I'm very blessed at NYU. I have rabbis. For you that are not Jewish, you have mentors. I have rabbis. My second call was to Dr. Young, who is my gynecologist. And I said to him, this is what's going on. I'm going to keep you abreast of everything. What do I do? He said, have all the reports sent to me. And we were off to the races. I got back to the radiologist's office. I asked to see the chest x-ray. I saw smoke, and on the bottom, I saw a huge mountain. He said, let's go for the CT. I knew at that moment that my luck had run out. I digress. I had been a smoker for many, many years from the time I was a teen. I had tried to stop smoking many, many times, and I was the person who was never going to get lung cancer. And my luck ran out. So I said to the radiologist, can I please see the chest CT? And there I saw a 5x3 mass. Not centimeters, but millimeters. And I said to him, I guess I need a thoracic surgeon. To which he said, are you in the medical field? And I explained to him that I had always been the caregiver of my family, for my parents, my husband, and my kids. And he decided to go back into the system to see where the mass could have come from. We went all the way back to 2007. He was able to get into the Beth Israel system, he was able to get into the NYU system, and I was clean. And then he said to me, Barbara, you had rotocuff surgery last year in another facility. I can't get into their system. You must call that office immediately. So I did that. I called the doctor's office, who I told the aforementioned story, that they found a mass, and she went to get all the pre-surgical testing, got on the phone with me, and said to me, she was completely silent. I said, what does the chest x-ray say? And her answer to me was, I'm not able to give you your medical information. And I was like, okay. I knew I was in really big trouble. And the other thing that was going through my mind was I was really pissed at that doctor. August 4th, 5th, 6th, and 7th were a bit of a blur. From our internist office, an immediate appointment was made with our pulmonary doctor. From there, I was rushed to the NYU Cancer Center for PET scans and an MRI of my brain, back to the pulmonary doc for breathing tests, and by Friday of the same week, landed in the office of my thoracic surgeon, Dr. Bernard Crawford. We all knew who would be my surgeon. Dr. Garay called on Tuesday, Dr. Tuchua, my oncologist. Me needing all of these doctors, it was surreal. But now they were my dream team. Two were strangers, however. Dr. Crawford didn't know this, but 26 years prior, he was a young fellow working with a cardiothoracic surgeon here by the name of Dr. Stephen Colvin. Dr. Colvin, may he rest in peace, had operated on my 9-month-old son. He was born with a right arch, and for the layperson, that means cardiovascular vessels that surrounded the aorta, larynx, and esophagus. Dr. Young said that there was only one doctor that he would allow to operate on his son. He was very, very close with our family. So Dr. Colvin was at a convention, and Dr. Crawford was taking care of my child, and at that time was a fellow. There was no discussion that Dr. Crawford would be operating on me, and upon meeting me, that story had been transferred to him many, many times, and he laughed when I walked into his office. His first comment to me was, "So you're Barbara Goldstein." And I was, and I am. So we met on Friday, and he says to me, "Well, how about next Thursday?" I was like, okay. We discussed the surgery. That's very straightforward. Unfortunately for me, the cancer from the primary spot uptook to the Hillier area, someplace up Hyler, never got that straight. And there would be 2 procedures that he was asked me if I would sign up for 2 clinical trials, which I said, of course, anything to help the next person. So the next hardest part was to tell my kids. They range from the ages of 42 to 26, and I also have grandchildren at that time that were 16, 9, and 9. So all adult children were told. Everybody was invited to join us on operating day, and my older son could not deal with this, so that was fine. I also asked one of my NYU friends to be there in the room to watch out for my family and to ask any questions not asked, and she was so proud of my family, from my youngest to my oldest, and they did it all together. You click into business mode when you are told that you have lung cancer, when you're told that you have a terminal disease. And the first thing I asked my husband was, we need to go to the attorney. And he said, fine. I have a 90-year-old father at the time. I have a handicapped brother. Things needed to be changed. All of these responsibilities laid in my hands. I needed to put things in order. Things needed to be readjusted. I went into complete business mode. You click from one to the other. Living wills, healthcare proxies, you name it, we had to sign it. All legal papers to bring to the hospital to go into Epic, so no questions would go unanswered. I was in the hands of the experts from that day. The patient I was, no longer the caregiver. That responsibility was turned over to my husband. I was not selling tickets to this event. Normally, I would surround myself with people. This situation was very private and serious. I told some close friends who wanted to be with me and didn't understand our or my need to be alone. The nurses and nurse practitioners on 14 were incredible. I was in a step-down unit until the chest tubes came out and went home Monday. Unfortunately, I showed back up on Tuesday. I developed crepitus. And for those who don't know that, it's basically your body feels like Rice Krispies or bubble wrap. I had sprung a leak. And my greatest fear was that they were going to put another chest tube into me. And as my fear would turn out, a pigtail chest tube was put on bedside, which was not fun. But I had an 8 to 9 day stay in a private room because that's who my husband is. He said yes, because they said I was only going to be here 2-3 days, but it turned out to be 8 or 9. Got out before the Labor Day weekend, just in time for my appointment with my newfound friend and savior, Dr. Shishua. Unbelievably, one of the private duty nurses had asked me on the floor, "Who is your oncologist?" And I said, Dr. Shishua. I couldn't even pronounce his name at that point. She said, "You're a very lucky woman." And I said, "Why?" She said, "He really hates cancer." I was like, okay, good to hear. So we went and we met with Dr. Shishua. After finding out what was in store for me, 4 rounds of chemo, 3 days a week, every 3 weeks. First day there would be 2 drugs. Then there would be cisplatin the second day, and the third day just cisplatin. One of my greatest fears was telling my dad. He was 90 at the time, and we had lost my mother to metastatic cancer. And in my mind, it would have been inhumane to tell him that his daughter had lung cancer. Once Dr. Shishua told us what was in store with the chemo and radiation, it was time to go visit him. So I decided to conjure up a story that it was pneumonia that had put me into the hospital. He was happy to see me. I looked healthy, and he needed to know that he would not see me for a while. Chemo wasn't anything I imagined. From the get-go, my veins decided not to participate. So a Mediport was scheduled mid-September. All that goes with chemo. I had white counts low, but that was fixed. Platelets dropped, that was fixed. Even when the nausea was not manageable at home, we would call in, and back to the NYU Cancer Center we went, and they made me better all the time. I had my breakthrough of anger about having cancer on October the 19th. And why I know this, Deborah reminded me, I kept a journal. And I read my journal before I started writing the speech. And I realized how arduous this 9-month journey has been. And on the 19th, I had a breakdown. And Dr. Shishua suggested, lightly, maybe I needed some help. And I responded, I help everybody else. We talked it out, and he asked again, and I said I would think about it. And the very next day when I went to treatment, I asked them to contact him and the social worker, and from that day on, I saw her once a week and then joined the lung cancer support group. What a big difference that made. I wasn't alone with just me and my hubby. The group is an amazing group of humans. From stage 2B to stage 4, every type of lung cancer, it is quite an education to be in that group. We have a little family. I have a support system. I am not defined by my disease. I am, however, annoyed at the twists and the turns in the road of this journey. I had PEs after my scans after the chemo ended, which now requires Lovenox injections every day, which I don't do very well because I wound up getting neuropathy from the chemo. So I have that done at the cancer center. I managed to fail radiation, and it had to be stopped 7 sessions early due to a barbecued esophagus. Then there were 3 other incidents that landed me in the hospital. At the end of the day, my first scan showed that I was clean. I am on the 3-month plan. I am not frightened of the lung cancer coming back because I have a remarkable team. If it does, they will fix me. I am here and I will continue to be, and you might ask why. Because of the four walls of the NYU Cancer Center, all the personnel inside of those walls, I could not have gotten this far without all the dedicated persons from the concierge desk, the financial office, the reception on the 6th floor infusion floor, all my nurses on 6. Whatever the medical problems are, they take care of me. Dr. Shashua handles everything medically in my life now, with some assistance of my best friend, my husband, who takes care of the rest of the journey. Thank you.